Hi, good afternoon. My name is David Ouyang. I'm a cardiologist at Cedars-Sinai Medical Center. I'm here with Nobuyuki Kagiyama at Nintendo University from Japan, and we're going to talk about the AI Echo trial.
Thank you, David, for introducing the trial. Actually, this time we conducted a randomized trial called, or abbreviated as AI Echo RCT, where we assigned sonographers to either use AI or with normal workflow, manual measurements.
Yeah, Nobu, what were the most exciting findings and what were the primary outcomes for this trial?
Okay, thank you. So here we randomized the use of AI on a daily basis. Sonographers used AI and they performed scanning. However, the measurements were all done by the AI on AI days. And such allocation or assignments are on a daily basis. On AI days, primary endpoints were focused on the examination efficiency defined by the time for examination as well as the number of examinations per day that one sonographer performed. And both primary endpoints were met with statistical significance. The time for examination reduced from 14 minutes on non-AI days, in normal workflow, to the about 13 minutes on AI days. And in addition, the number of examinations per day increased from about 14 to about 17 on AI days.
Yeah, Nobu, my understanding is that this is a already FDA cleared AI software that's being implemented in Japan.
Right. Yeah, and yes, this software, US2AI software, has been already approved by FDA as well as Japanese FDA, which is called PMDA. However, the number of parameters that have been approved is about 23, and we used a little more, about 70 parameters for this research.
And the reason I say this is that I wanted to highlight, I believe this is the first clinical trial of this technology, right? Despite the fact that it was already FDA cleared and PMDA cleared, no prospective randomized assessment has been done before.
Right. That's the important point that we are facing. A lot of AI technologies have been introduced in papers, but very few prospective trials have been conducted in the real world.
Yeah. I was surprised to see that in your paper, even the standard of care sonographers took about 14 minutes to do a study, 16 minutes, and with AI it got down to 14 minutes. In the US, oftentimes sonographers are allotted 45 minutes to an hour. Are Japanese sonographers just more efficient?
Yeah, thank you. It may not be that Japanese sonographers are more efficient. I think the difference in scopes of the echocardiography or examination. This time we focused on something called screening echocardiography. I think this is less common in the United States. However, this is, for example, routine check for pre-non-cardiovascular surgery or routine checkup for the health, for general people. However, this is quite common in Japan, and the demand is also increasing because of the aging of the society. And actually, in Japan as well, we spend like 40 minutes or more for a detailed evaluation of, for example, valvular heart disease or other cardiovascular diseases. However, this time, this screening echo is usually done within 20 minutes. And the reason why we focused on this screening echo is that current AI system is not capable for everything. Including those quantitative analysis of regurgitation or other more detailed cardiac function analysis. So we focused on this screening echo, which can be potentially replaced by the AI measurements.
And my understanding is that the AI does not do the scanning. it does the measurement, but it also does not do the quantitative assessments. So the mild, moderate, severe things are still done by the sonographer and cardiologist.
Right. However, because we focused on screening echo, there's only few patients with significant valvular heart disease.
And you mentioned to me before kind of this discussion that you found some interesting findings. What did you find?
Yeah, actually, one of the interesting findings here is that the image quality, this was not something that we have expected before starting the study. However, image quality was actually better on AI days compared to non-AI days. And this is probably because the sonographers were able to focus on the scanning rather than measuring some difficult parameters.
Yeah, I think that, that often brings up the questions like, now that you've done the trial, what now? Are you planning to have this be the general standard workflow at your university, or is it planned to phase it out, or what does deployment look like?
Actually, yeah, thank you. We are now using this AI software in our clinical practice. And, like every procedure in cardiovascular or in medicine, this use of this AI system has learning curve. So I feel that sonographers are doing even better compared to when they start using this software now.
One question I had is, particularly as you mentioned, it's a screening echo, so I'm assuming all these patients are outpatients. But you also described that the sonographers scanned more patients. How are there workflow changes that happen? Like, in the U.S., people are slotted for appointments. So we have a set number of appointments based on what we expect the sonographers to do. How do you actually get more patients into the echo lab?
Well, actually, this is an interesting point. Actually, this study workflow was employed in one of many echo machines in our lab. And, there's some extra patients coming directly from the clinics. So those patients are waiting for a sonographer to be available. So these extra studies were done by picking those patients. And importantly, in this trial, because we set the number of examinations as one of the primary endpoints, those sonographers spent extra time to scan more patients. However, in clinical practice now, we spend those times, the extra time yielded by the use of AI on more discussing some different tasks, like discussing patient outcome or discussing patient disease status with cardiologist, which is more clinically enriching and engaging for sonographers because their motivation matters very much for us.
So that was an important piece, and I wanted to ask, especially for this trial, my sense was that it was an unblinded trial, meaning that the sonographers knew when they were using AI and not. And it sounds like you had very motivated sonographers. Can you describe to us how you kept track of time, or how did you actually measure how long it took each study?
Oh, thank you. Yeah, actually, the time was measured in a very, manual way. And there's just a time clock on the machine, and they just press the button before starting the study and after finishing the study. And also the same thing was performed on the when measuring those parameters after scanning the images.
And the reason I bring this up, and you brought it up, is do you worry about Hawthorne effect in this kind of study? Because the sonographers want to look good and want to speed up, and particularly in a trial, put their best foot forward.
Yeah, but I think they wanted to appear better even in non-AI days. So I don't know, but but I think, and I did not explicitly explain what the primary outcome was for those sonographers.
And I guess the proof is in the pudding. Now that you've deployed this AI, is it that you're still seeing the same number of studies being done post-study in the routine clinical practice?
Thank you. Yeah, actually, I have not counted those yet. However, I have a feeling that the number is similar, at least. And one thing for sure, they actually like the use of AI in real clinical practice, and they continue using that.
Yeah. For the other researchers in the audience, are there any advice you would give them in terms of what does it take to run an AI clinical trial, or what are learnings that you've had that you did not expect from starting the trial?
Thank you. Actually, I wouldn't say there's no challenge to implement AI to your clinical practice because, for example, this AI technology runs with some computers, which may have conflict to your local computer systems in your hospital. So first, I had to talk intensively with IT departments to really implement this implementing this system into the clinical workflow. And plus, challenges will be apparent after you actually starting or after you launching the system. So I recommend to have some running period before actually starting right. This time, actually, we had 1 month trial period before actually starting the study.
Got it. And what's next for your group? I think that this is an incredibly amazing study. Do you plan to study the same software in other formats or other software, or what's next?
Yeah, thank you. So as we discussed, one of the limitations of this study is generalizability. This study was performed in a very specific condition in which we focused on screening echocardiography, and this study was single-centered, which may not be applicable to all hospitals. So we are going to plan the multi-center study, and also including more various kinds of patients.
And I think that this trial really focused on efficacy. Was there any concern about precision or accuracy?
Thank you.
Particularly as you talk about maybe next stage is sicker patients or patients with actual valvular disease.
Oh yeah, and then let's see. I don't know, but technology is really rapidly advancing as you are showing in the multiple papers. Valvular regurgitation quantification is coming, and other more detailed analysis are coming. So I'm quite optimistic to use those technologies under the supervision of echocardiologists, of course.
Yeah, fantastic. Nobu, do you have any final thoughts for our audience or things that you wish to say about your trial?
Yeah, thank you for listening to the interview. My thought is that AI is now coming to the real clinical practice. However, if you expect it as a panacea, it's not real. There are some challenges to implement this into your clinical practice. However, once you get used to it, this AI system is really a good partner for your clinical practice, reducing your your workload, and helping clinicians motivate sonographers. So I think, if you can take effort to implement it in clinical practice, I think it's a good start to use AI in medicine.
Yeah, fantastic. I'm really looking forward to see what your group does next.
Thank you.